So I believe that in some ways the nature of librarianship in the healthcare sector at least is changing dramatically and is set to change further. We're working to a strategy within the NHS called Knowledge for Healthcare, and within that we're positioning services as business critical services, and to that end we need to bring the skills and expertise of librarians as close as possible to decision makers. That might be the decision maker at the ward level, and it might be the decision maker at the level of the board. Now, to do that, we also want to release staff in services across the country from as much of the routine work as we can, as much as possible, whether that's through streamlining, through coordination, through greater collaboration, or through the application of new technologies, which is certainly coming on stream into our field. So in that sense, I think we'll be looking to see librarians being more and more involved, working aligned with decision makers, whether that's at the board level, supporting executive decision making, or at the level of the ward where we're making patient decisions, and indeed out into primary care and outside the locus or hospital setting, which has traditionally been associated with libraries. So on one hand it's changing significantly, and yet on the other this is not so very far from the information brokerage role I took when I first joined the health service in the early 80s, working both in information and a health education role. The application of new technologies makes an enormous difference. The use of AI to support systematic review work, for example. We're at the cusp of something very, very significant now, and there will be changes ahead for which we need to prepare ourselves and those whom we serve.